Good morning, everyone. Bonjour, bienvenue.
Good morning and welcome. And thank you for coming, so many of you this morning.
Here in Ottawa, should go back to winter at some point. It's a pleasure to welcome you. My name is Jean Lebel. I'm the Director of the Agriculture and Environment Program here at IDRC, one of the 4 programming areas of the Center. And the Center, as you know, is a Crown corporation that is dedicated to the development of research capacity in developing region of the world through grant making to institutions and researchers directly in those developing regions. And we have been doing this type of business for the last 42 years. Today we have a speaker that is coming from University of Washington, Rachel Nugent, that is with us. And that's going to bring to us, the top-notch knowledge and most recent knowledge about the nexus between agriculture, environment, nutrition, and health. Rachel is an economist by training. We've known each other for at least more a decade. That's very well said, more than a decade. We first met around the vicinity of the World Summit of Sustainable Development in Joburg in 2002. At that time, Rachel was at the Fogarty International Center of the NIH, managing environmental and health programming, and making connection with us with our EcoHealth program. And prior to that, she also had an history with IDRC. She was at the FAO and collaborated closely with Luc Mougeot and his team around urban agriculture. In her career, she moved on. She works at the Population Reference Bureau out of Washington, as well as at the Global Development Center. That's right. I have the
Center for Global Development.
Center for Global Development. Sorry, Rachel. And more recently, she became associate professor at University of Washington in Washington State on the west coast of the U.S. Now, last year, Rachel gave me a call, and she gave me a call wearing the hat of the Chicago Council on Global Affairs. The Chicago Council on Global Affairs is a very well-known think tank in the U.S., managing to do independent research on key issues, and they have a group that look at agricultural world. Rachel was asked to produce a report and to invite people to help her with the report, to articulate the framework, the outline, as well as reviewing, and I was part of that team, and it was a real pleasure. The report, there's a few copies that are out there, and it's also available in PDF, and if you want a hard copy, leave me your business card or your name, and I'll make sure that you'll get one also. The report put the table on where we are with the state of agriculture in relation to nutrition and health, brings worlds that are not necessarily talking to each other together, and demonstrate that there's a role for agriculture to prevent non-communicable disease. And it's important to look at it because, as she will explain, we are not necessarily in an epidemiological transition going from communicable disease to non-communicable disease, but we are in a situation in many places of the world where there is coexistence of the two. And if we don't take a broad look at those health conditions, we are less likely to make progress on the development front in relation to health, environment, and agriculture. So without further ado, I'm going to ask Rachel to give her presentation on some of the key elements of this report. And we will spend about 30 to 45 minutes on the presentation, and then we'll move into questions. And before I pass you the mic, I just want to welcome also the people that are looking at us on the web and participating fully into this conversation. You will have the opportunity to bring your question. We have a monitor over here where we can read your question to Rachel, and she can provide you the answer. So thank you for being with us this morning. So Rachel, without further ado, welcome, and the floor is yours.
Thank you very much, Jean. It's certainly a pleasure to be here, both because of our long-standing personal relationship where we've shared a lot of ideas about health, about the environment, about development and what we can do. And I really admire what is done here at IDRC, at CIDA, at CIHR, and the other organizations that are based here in Canada. I've had the pleasure and privilege to work with a number of these Canadian organizations over the years. And now living in Washington State, I'm I'm really your neighbor and enjoy being close to Canada in many ways. This is a beautiful room, but it's very wide, and so forgive me if I swivel, because I like to look at the audience, but I recognize that you're here and that you're also with us on the web, so thank you for joining us. Jean gave me a very nice introduction, so I won't go into any other background except to say that when the Chicago Council called me this year and asked me to examine the issues of agriculture, food systems, and non-communicable diseases, as a part of the thinking about the UN, the United Nations high-level meeting on NCDs that was held in September of last year, I was really thrilled, in spite of the fact that I had just taken a new job at the University of Washington and I was finishing up some things from my old job, so I had plenty on my plate. I said yes, and I haven't regretted it, even though it was a very busy year, because it allowed me to marry things that are very important, the agriculture work that I used to do before I went to the NIH, and the health work that I've been doing now for more than a decade. And I truly believe that there is an opportunity right now for all of us that work in these sectors to think about, if not a marriage, perhaps a better cohabitation, and to move forward some of the goals that we have across these sectors. Now, because it's a very broad topic, it can be risky. There's a risk of speaking only in generalizations and saying a lot of things that everyone has heard before. And I'm trying hard not to do that, and in not doing that, sometimes I may provoke. I kind of do that intentionally. I want us to think and challenge our assumptions. So I hope that I can achieve two things with this talk here. One is to mention something or say something that touches on your own work in some way, or something that you care about. And the second is to say something either that surprises you or that gives you something new to think about, or a new way to think about. So I hope I can accomplish those things. So here's what I will cover. Let's see if I can reach the mic and the computer at the same time. We'll look at a brief history of agriculture, health, and agriculture nutrition, policy, and research. And then I'll provide a little background on non-communicable diseases. I'm sure that there are some people in the room that are quite expert on that, but again, because I'm trying to connect a number of topics, I want to give you enough of a background in NCDs to understand why you should care about them, because often people in development don't see that there's a reason they should be concerned about NCDs. Then I'll talk about some of the big trends. Very, very briefly, I want to talk about some of the trends that intersect here in agriculture, nutrition, and health, and why it's important to recognize them as a backdrop for our discussion. There are a lot of conversations going on here in agriculture and nutrition, and health. The environment, of course, comes in there, climate change, and so on. There's a lot of conversations, and they're not all really after the same objectives, which is perfectly fine. So I want to be very clear about my own interests and why I did this and what I think we can do with it. So my interest in particular is agriculture and health. What can agriculture do to address health issues, specifically non-communicable disease issues in developing countries? It doesn't have to be your specific interest, but I hope that somewhere there's a little bit of overlap so that we can have a good discussion. I know that there are many people deeply committed to working on ag-nutrition linkages. There's been a lot of great work on that, including CEDA and others here. And I think we can use some of that overlap to better understand how to reach health. And I'll talk more about that. And then we'll take a close look at these links. I'll try to dive a little deeper. I was asked to speak specifically about agriculture here, so I won't speak a lot about health or about nutrition, but to try to dive into the opportunities that I think exist for change in agriculture to better address these connections. And at the end, I'll talk a little bit about a research agenda, because we are in a research organization here, and there are always more research needs. And I'll give just a little taste of some of the recommendations that are in this report. Of course, it is on the web, and there are a lot of recommendations, and I'm not here to give you recommendations per se, but to have a discussion with you. Before we jump in, this is a very, very stylized schematic of the conceptual framework, if you will. It's really a simple chain of linkages connecting agriculture, nutrition, and health. Everyone in the room here probably has some idea of this in mind when we speak about agriculture, nutrition, and health. So your conceptualization of it is just as good as mine, but I wanted us to have this in mind as I go forward with the discussion. The connections are pretty simple. Agriculture and food production determine what we eat. What we eat affects our health. Food consumption is a result of many factors: the quantity and the quality of what we eat, food diversity, cultural habits, what we can afford. There are many more that are not on there. This is a very simple version. There's genetic and epigenetic and environmental factors, the built environment. So I could build this out and make it very complex, but that's not the point here to try to include and talk about everything. The point simply is that what we eat is one of the most, if not the most, modifiable influence on our health. As individuals, we make a lot of choices about our health that are based on what we eat. The environment around us influences that, and we can't control everything about the environment. So we alone can't modify our diets sufficiently to ensure good health, and that's why we have to pay attention to these broader factors, and we need help from the agriculture and food system, and that's what this report is about. So let me make the link to development very briefly here, and then I'll give you a few examples later. In the poorest countries, as we know, agriculture drives the economy, and often we make the assumption, and it's borne out in empirical measure, that as as per capita income increases, as development happens, health will improve. And we see often an epidemiological transition happening as countries get wealthier. But that is by no means guaranteed. And we have known since the 1993 World Development Report and the Commission on Macroeconomics and Health reports and so on that, in fact, there's a dual causality, that health also creates development. And so we need to understand this new phenomenon that we see of non-communicable diseases and how that fits into our paradigm, if you will, or our view of how health affects development. And I contend, although we don't have good empirical evidence yet because it's probably too new to know, that non-communicable diseases don't act like infectious diseases in their relationship to development. And we need to understand that relationship better, and how NCDs emerge in poor populations and contribute to poverty as well. So both a cause and a consequence of poverty, and we need to understand that. So let me go on to a short intellectual history here of agriculture, food, nutrition, and health. And I've divided history into three phases. The first generation of ag health and ag nutrition research is mentioned here, focusing on ag and food, worker safety, such as pesticide exposures, acute threats, BSE, H1N1, food residues, and so on. There was some excellent work, including some of the work that came from IDRC and continues to, and Dr. Labelle himself, through EcoHealth. But overall, it included a relatively small number of researchers and small number of studies. In addition, there was a literature in the research community of nutrition and health, looking at the long-term impacts of nutritional, especially early childhood interventions on cognitive development and other kinds of health outcomes. Again, very excellent research, often looking at micronutrient interventions, but not really related to agriculture per se or broader health outcomes. What I'll call the second generation, I think, was started by CGIAR and especially based at IFPRI. It brought in nutrition more explicitly, and again, it cast a pretty it produced some very good work. It cast a wide net, but it didn't really take off in the sense of connecting up to all of the different sectors that were involved. It wasn't very well funded, and that work kind of happened in the early 2000s. As this mentioned, there were some quite a few briefs produced. Some of the CGIAR centers were involved. IDRC's program, several of them that I mentioned there, all doing very good work, but not what I would call a real takeoff. I think the third generation began with the New Delhi conference that was sponsored by IFPRI and had a number of others behind it, FAO and World Bank, and it was a little bit less than a year ago. It was a very big conference. It included 8 major papers, 21 briefs, an online quiz, a youth writing contest. It had everything, and it was very valuable. dozens of topics, 900 plus attendees, and I would say that what it did was to begin to change the conversation. And we're at a point now where we can build on that. And I think that there have been some events happening since then that have built on that. And as Ian and I were just speaking, we want to maintain the momentum. What can we say about where we are? Well, the beginning of a community is there, because as I've been talking about this topic since organizing the advisory group last year for this report, since the NCD meeting in September at the UN, and I've been invited to a number of places to talk about it, it's clear that people are already thinking about this, and there are a lot of communities of people that are ready to do something about it. These include the Caught Up initiative in West and Central Africa, activities in specific countries, South Africa, Bangladesh, and the Caribbean, to raise to a high level, to ministerial level and above, these cross-sectoral ideas about how do we go forward, improving health, improving development, etc. So yes, a lot happened in Delhi, in New Delhi, and the NCD high-level meeting gave added impetus to it. And here I checked off, yes, awareness has been raised, particularly about NCDs and about some of these connections. Actions have been proposed, particularly to control NCDs. The WHO, the World Health Organization, is in the lead in carrying forward what was requested by the UN General Assembly last year. So there are targets and indicators being prepared that will be proposed and reviewed by the World Health Assembly in May of this year. A global monitoring framework for non-communicable diseases by next year. Multi-sectoral action plans and so on, all the sort of usual UN stuff. But I think below that level is where the action really is, and where there are a lot of groups that, some of whom have begun to form a community of practice, and again, I'm hopeful that we can keep that moving forward. And I've mentioned a few of those here, which some of you are probably involved in. So just a very quick review on non-communicable diseases, and just kind of for fun, I've put up here as a title a number of the names that are used. NCDs has come to be fairly common, and it was used by the UN, non-communicable diseases, but there are a lot of people that don't like that term. They like chronic disease. But then there are people who feel, well, chronic disease includes AIDS and TB. We don't really want to include them. So how about chronic non-communicable diseases? Then sometimes people have used lifestyle diseases, but that's not so desirable because it implies that people choose to have these diseases. So how about, I often use nutrition-related diseases because I like to focus on those that are nutrition-related, and that's what I'll do today. But I must say, if you have some good suggestions, the community is certainly not at a consensus point yet on the title, and that does get to be confusing. WHO defines non-communicable diseases as these four that I mentioned here: cardiovascular, diabetes, chronic respiratory disease, and certain cancers, for the purposes of the meeting that was held. And that raised a lot of controversy as well, because it excluded things like mental health and some other very important chronic conditions. But again, what I want to do is focus on those that relate to poor diet or nutrition, because that's where we obviously have the best opportunity to connect to agriculture and to nutrition. And so that's what I'm going to talk about here. What do we know about NCDs in developing countries? Just briefly to review, it is still surprising to many people that the NCD burden looks a lot like it does in developed countries, but with a younger face and emptier pockets, as it were. This map shows how many deaths there are from heart disease around the world at any given age. So it's an age-adjusted mortality per 100,000 people, and the colors show you that the red and orangish colors show higher mortality rates on an age-adjusted basis than the blue and gray. So you can see that the highest age-related, age-adjusted mortality from cardiovascular disease is in East and Central Asia, in Africa, Eastern Europe, and some of the poorer countries of Latin America, a couple of the poorer places. That clearly shows that there is a poverty element here. For instance, the average age of first-time heart attack sufferers is 53 in South Asia, 6 years lower, 6 years younger than in the rest of the world. And this kind of disparity between rich and poor applies not just to heart disease, but to many of these chronic diseases. 1/4 of all deaths from NCDs happens to people below age 60. Now, of course, there are more people in the developing world, so a larger number of those deaths is going to come from the developing world. As we know, 80% of those NCD deaths are in the developing world. But look at these 4 countries that we studied in the report just very briefly: Burkina Faso, Bangladesh, Brazil, and in the UK. What you can see is that more than 3 times as many 60-year-old men die from heart disease in Bangladesh as in the UK, and almost twice as many as in Brazil at that same age. So I'm going to not go into more detail about the diseases and risk factors. I just want to point that out so that we have in mind that this is a very important issue for development, a very important issue for poverty. A little bit on the risk factors here. We're familiar. This is data from the Global Burden of Disease 2004. There will be a new Global Burden of Disease coming out this year, so we'll have updated data, but I don't think we'll see large changes. What we see is that the risk factors that I'm talking about here, high blood pressure, tobacco use, high blood glucose, those that are very clearly nutrition related and, if you will, lifestyle related, forgive me the term, are at the top of the list, even in poor countries. And a new Lancet series this year tracks metabolic indicators over hundreds of country years and millions of people. So they gathered a lot of data to look at the trends in metabolic risk factors. And you can see there, sort of indirectly, the effects of the dietary changes that are taking place around the world. There's increased BMI, body mass index, in almost all populations, high and increasing prevalence of hypertension, especially in low and middle income countries, and high glycemia in all developing regions except Africa. So this epidemiological transition I mentioned earlier, as Jean mentioned, is also an epidemiological coexistence of high burden of disease. And the idea of rich country diseases really doesn't apply anymore. So, in fact, you can notice that there's not that much mortality in the rich countries, that is the dark blue on this graph, from a lot of these diseases, even after adjusting for differences in population size. So I could cite country-specific data, and in the interest of time, I'm not going to do that, but I'm more than happy to provide country-specific data across a lot of these risk factors and diseases if you're interested afterwards. And I think the bottom line here is that NCDs are both a cause and a consequence of poverty, and the nutrition and food environment are a very, very strong element in that. Let me go on then not quite that fast, what I call winds of change. Each of these items here, you will know a lot about each of them in your own specialty fields, and they could be a full conference in themselves. And all I'm trying to do here is give them as a backdrop for our conversation. We need to recognize the things that are happening in the agriculture, food, and health sectors, and then try to build on our opportunities. I'll elaborate on none of them really, except just to say we understand that agriculture development and investment in agriculture development is sort of in a new place in the last few years, brought on by crisis, but I think it creates an opportunity with, again, of course, a new emphasis on sub-Saharan Africa. We've seen food shortages, price spikes, and market speculation, but still we know that there is sufficient productive capability in the agricultural sector to feed the world, and we've had that condition for a long time. Climate change is a big factor, but even so there are lots of ways that climate change is going to be able to contribute to greater agricultural productivity, and it remains a distributional issue really. Demographic effects, of course, happening, and often that turns into fear and panic, which it needn't be, but it has to be factored in. Global health funding has been soaring over the last decade, with a lot of disease-specific initiatives, very narrow, sometimes technology-based initiatives, but in the last few years, as people will know, much more talk about how to integrate, how to build on systems, create sustainable delivery of services. Let me just say it really clearly now while I'm thinking about it. There is no way that we can treat our way out of this non-communicable disease problem in the world. We cannot afford, even in the U.S. and Canada and in the U.K., to solve it through treatment. We have to emphasize prevention more than we do, and that's again where agriculture and food have a very strong role to play. We really know when we get here to the commercialization of the ag and food sector and changes in consumption patterns and eating habits, etc., we know this is spread around the world. We're talking about consumption of energy-dense foods, high in sugar, salt, and fat, more sugar-sweetened beverages, more processed and less fresh food, an overall increase in energy intake really across the board in the world. Wherever you're working, in rural or urban areas, I'm sure that you're seeing it. What can be done? And I'll go on to that in just a moment. I couldn't resist throwing in this slide, what's new and what's not, kind of as a jab at the perennial things you see in the newspapers, especially around the new year, what's hot and what's not. And I put some things on there, some of which I kind of agree with. So what's new in the area of ag and nutrition, the REACH that I know some people here are involved in, or people at CEDA agree, which I'll mention in a little more detail later on, which is an agriculture consortium trying to work across private-public arenas. I have coined a new one called BON for the Anglophones, which is a takeoff from the SUN, the scale-up nutrition. The nutritionists in the audience will know about scale-up nutrition because it's been all the talk for some years now, and I want to suggest that broadening out nutrition, BON, would be perhaps a useful thing to do now that we're at the stage of nutrition having come to a better agreement about, the nutrition community, if you will, a better agreement about how to work together. I'm not going to go through both of these lists. I put it up here mainly to suggest that we really don't need more new ideas or more pseudo-new ideas. We have a lot of good ideas, and we have partnerships, and we have acronyms, and we've got plenty of that stuff. I think we need to more seriously say which ones work and which ones don't work, what elements do we need to keep and what do we toss out. And I think we're at a point where we could perhaps do that. I hope I haven't gored any of your sacred oxes, but the development community is a little bit, I don't know, a little bit famous for needing to have a new idea every few years, and I think we really don't exactly need to continue that. Let's go onward then. How can we make change? I hope that we can focus our discussion today and into the future on the opportunities for real change. And we have offered in this report, as I said, a lot of recommendations, 35 recommendations for 5 key actors in these categories. So there are 6 categories here: governance, financing, policy, research and education, technology, and personal behavior. I'll give you a couple of examples of what I mean, and then I'm going to go on to more specifics, particularly in agriculture and in nutrition. So, for instance, in governance, are there new institutional arrangements needed? Or will ad hoc and temporary committees and working groups be sufficient? To be specific about that, what the UN has done is to set up essentially an ad hoc temporary working group to address the issues that arose and the demands that arose out of the UN high-level meeting on NCDs. That might be sufficient. I don't have a prior on that, but it might not be sufficient. And we have a moment to make decisions and submit them to the General Assembly about what's needed in terms of governance of this. And particularly the multi-sectoral aspects can quite easily be pushed aside while the health community says it's all about salt and fats and polypills. So I put out that sort of either or because I think we do have an opportunity here. In financing, can results-based financing or other innovative financing be used to spur less segmented project development? And how would we measure the rates of return on those? And as an economist, I'm particularly interested in the measurement, which I'll talk about more momentarily, and the difficulties of measuring across sectors, across scales and across levels where you really don't have the same kinds of units of measurement and capacity. That's a big challenge. And again, I don't laud the hegemony of economics in policymaking, but I recognize that it's often there, and if we can come up with good economic rationale for doing things in a different way, that often can move us forward. And so I'm interested in people's help with that. I think there are a lot of actions possible when you look across these different avenues of change. So let's get more specific. Oh, there's the report. The food system. This is the simple agricultural supply chain that's in the report. It looks quite simple, but it gets more complex day by day in the real world. I'm going to spend some time on this slide here, so you don't have to hurry to try to read it. I'm going to talk a little bit about what's really happening in this agricultural supply in the real world, and then go through a few examples. The question here is, how do these connect? We have agriculture on your far left, farmers, fishers, agribusiness and extension services, the inputs and the outputs of the agricultural system itself. We have then primary food distribution, storage, and processing, which includes a lot of others, packers and millers and crushers and those who do the sort of really hard hand-to-hand work. We have then secondary food storage and distribution and processing, which may include importers and exporters, the manufacturers of the processed foods that we see, food and beverage companies, for instance, and others. And donors are often involved here as well. We then have food wholesaling and retailing, the many places that people buy their food, from the street vendors to the supermarkets. And I'll say a little bit more about how that has changed in a few moments. And then food marketing. And often when we get concerned about non-communicable diseases or about poor nutrition, we want to point a finger at the marketing and the advertising and all of that we think is wrong with the food system. And I would contend that, well, a lot of that is true. We have good examples of it, and there's certainly some that are not far off of tobacco companies for having done very dishonest things. We also can harness the power of food marketing for good things, and we need to, because we really can't do it all with just good nutrition education from the public health sector, which has its place, but it can't do enough. So let me go into some specifics about how these connect and how we might see this as more than a supply chain, but a value chain, which is the terminology that people use. It's the latest, greatest. But a value chain that can produce good health outcomes and good social outcomes. First, there are some who suggest that rather than look at these individual boxes, we should really look at this whole value chain in toto. That should be our unit of analysis, because we've been very focused on the output of the farm sector, on quantity, as I'm sure you know, rather than quality or rather than diversity. And here I'm talking quite a bit about the measures that have existed in agriculture development and even in the nutrition world. Just give those kids more to eat and they'll be fine. Well, we know that's not true, but somehow that still seems to prevail in a lot of places. So the product of the whole supply chain is really the output that we need to consider. And I know someone who did a study in Central Africa a little while back where she was trying to identify, this is an economic study, fairly rigorously measured, trying to identify the connection between agricultural production and dietary intake and health status. That sort of schematic, that conceptual diagram I showed you at the very beginning. How do we go from ag to diet to health? And she found no connection. She couldn't identify that connection, which is shocking to me, even though I've tried several times to demonstrate the causality using econometric methods and good data, and I have failed as well. So I think that gives us something to think about. What is the causality? What do we expect it to be, and how do we measure it? And let's see if that's what we're actually doing. A couple more examples specific to different parts of the supply chain. First, ag and ag policy and how they affect food availability. Let me give you an example of a real commodity. Let's take oil seeds, which have really undergone a lot of transformation in the past few decades. 40 years ago, oil seeds of all types were widely available, and then soybeans, sunflowers, rapeseed, and palm began to be emphasized and greatly increased in production, in some cases with subsidies. Those markets were globalized. Tariff and other barriers were removed on trade. Argentina and Brazil were subsidizing soybean productivity. The U.S. was as well, although much less so than some of its other subsidies. There were lower export taxes on oilseed products, and there were greater research investments for those commodities. What was the result? The supply chains globally were reorganized to reduce foreign direct investment in a lot of the developing countries producing oilseeds and particularly soy. And processing and manufacturing came to be much more integrated, horizontally as well as vertically. This happened in Malaysia and Indonesia for palm oil products, for palm and palm products. And as the result, we had manufacturing changes because prices changed, particularly for palm. The price came down a lot. And so hydrogenation occurred because it was cheap and stabilized food. And this led to huge increases in the volumes of different kinds of vegetable oils that were available, that were used in primary and in secondary processing. And I know, too, that there are trade concerns. I know that the Canola Council of Canada, I just learned, has brought a trade complaint on soybean and palm oil producers. So there's been a globalization, a change in the manufacturing, and very much a change in the kinds of products of this whole supply chain in that example. I'll give you one more example to give you a sense of the fact that this is really a very generalized kind of phenomenon that's been happening in our food system. Apples in China. There's been a lot of industrial innovation as well as government support for apple production in China. Reduced taxes on fruit production in the early 2000s, expanding agriculture in western China, where the government wanted to expand production development opportunities. Their apples, Chinese apples, were perceived to have the opportunity to be price competitive on world markets, and so the government made investment in post-harvest supply chain, phytosanitary standards to bring them up to acceptable world standards, and production of ancillary products. And China's share of the global apple market rose to 79% in 2009 from 50-some% less than a half a decade earlier. Apple juice concentrate, a derivative product that, of course, was less expensive to produce than previously, became a major export, and now China is the major supplier of apple juice concentrate to the U.S., and that ingredient goes into a lot of manufactured foods in the U.S. as a substitute sweetener. So there are other examples of this, and really one of the best researchers on this kind of change is Tom Reardon from Michigan State University. I spoke to him a few weeks ago when he was in China, and he described some of the transformation in the food economy that he's been seeing. Just to sort of summarize for you the main things that are happening. Changes are in the traditional supply chains, staple foods like rice and potatoes, as well as niche products. This is not a niche phenomenon only. Supermarkets are spreading. First, they go to the rich and the middle class in urban areas, and then they spread to middle-sized cities, eventually to small towns and rural areas. He's seeing that already in China throughout, all the way to rural areas. There are regional, multinational wholesalers that are doing what he called follow sourcing. They're sourcing food ingredients from some places and then setting up manufacturing or retail outlets in other places, and so hence this vertically integrated chain of production. Food consumption is increasingly the processed and semi-processed foods, and many, many, many small farmers are involved in this whole chain of production. Those that have the assets that they need, like access to irrigation, to credit, some education, they're involved in these dynamic commercialization processes connecting the rural areas to the global markets. What's excluded, Tom says, of course, not surprisingly, are the resource poor, very small farmers. And that's, of course, communities that we need to care about, but we need to think about how to get them into the commercial sector or other things rather than sort of stopping that commercial process. Tom says, looking at the impact on consumer food security, he studied it in India, he sees it in Bangladesh, in Ethiopia, and in Vietnam. This isn't yet something he's willing to say is a global phenomenon, but for the consumer, he's seeing reduced cost of food, increased food safety, reduced price volatility, and increased food availability. Those are all good things, right? On the negative side are the things that I was talking about earlier. So how do we kind of marry or reconcile these? Because this is the real world that he's seeing and talking about. It underscores the importance of investing in the midstream sections of the supply chain and upstream into agricultural support services. And so that's what I think we can talk about is sort of what are the strategic investments. And I was at FAO and speaking with the Investment Center and with IFAD a couple of weeks ago about these things. They are looking for these opportunities to invest in. For instance, can we reduce within the agricultural system the 20 to 45% of food losses that occur in both the production and the consumption side? In the developing world, it's generally on the production side. In the developed world, those losses are on the consumption side. But in either case, in both cases, it's really tragic. And to talk about inadequacy of food supply and food insecurity while we're wasting so much food really begs for a serious response. How can we do that and save some of the fresh produce, fresh products that people need more of for their health? How can smallholder farmers get tied into a commercial supply chain and get credit and business advice? I'm going to quote you a fellow that's doing this in South Africa because I think his words can really speak better than mine can on what they're doing. He says, a tool to align agriculture, sorry, I'm quoting the wrong person. Myself. He says he's working with these smallholder farmers in South Africa. They're subsistence farmers, and he's trying to help enhance their value chain. He says due to the fact that they have minimal capital and all their earnings are completely hand to mouth, he says the only motivator at this stage is cash. But we've had some success with where we have developed subsistence farmers into early stage commercial farmers to develop their mindset to one of producing better quality foods of higher nutritious content where they can sell their product into a niche market such as McCain's of the Spar Group, which is a very, very big food retailer. We've taught and mentored some of these communities into thinking broad scale about what they're actually producing and why. And though they still focus on the profit margin, they're beginning to realize that the quality and nutritional value of food is more important than just quantity. I think that speaks worlds to what is possible. And I'm happy to put anybody in touch with him because he's really an inspiration. So let me move on from this. I know you may be asking, and people legitimately would ask, are these kinds of changes possible? Are they feasible? Are they affordable? Well, a report that was prepared for the high-level meeting in September about the costs of non-communicable diseases from David Bloom and people at the Harvard School of Public Health and the World Economic Forum jointly said it will cost $47 trillion between now and the year 2030 to address non-communicable diseases if the status quo prevails. And I think that's something that well, the numbers can be quibbled with and economic models are no more than economic models. I think we can do a lot for less than $47 trillion and maybe save on some of that. So let me give you a couple of real examples. First, because it's here on the slides, the actors. There are 5 groups that I've pointed to in this report that need to be involved in this. Consumers and their representatives, because they're really key, and how consumers and consumer groups express their demands, their needs, their preferences is really important, and it can be modified. International organizations, national governments, agri-food business, and donors. And I have recommendations for each of them. I'm not going to go into all the details, but let me first give you a couple of examples. We do need tools. We have plenty of ideas. We have partnerships. We have consortia. We need tools to move us in the right direction. So I've talked quite a bit about the agriculture and food value chain, what Michael Porter and Mark Kramer at the Harvard Business Review called shared value, and much has been written about their shared value ideas, ways to take social, environmental, and health goals into account. An example that I can give you here is what I already quoted, this Courtney in South Africa who's working with farmers that are now selling to the Spar food giant. And there are other examples of that and the regional supermarket chains, the Costco's, the Walmarts. Costco, by the way, I just learned yesterday, buys half of the world's supply of cashew nuts. Half of the world's supply. Now that is a lever for change. And Costco is working with these smallholder supply chains to try to not upscale, but educate them to be able to participate in a sustainable and profitable way in those supply chains. I think that that's fantastic, frankly. The Harvard Business Review, in a more recent article just a few weeks ago, listed, I think they had 10 of the world's most audacious ideas. And in their category of audacious ideas to tackle social problems, one of them was produce more apples and less corn. Now, I think the point of that is that these issues are on people's radar screens. And again, it creates a moment to do something about it. That better nutrition is something that we all need. Okay, so value chains are one tool. Another tool is what I call mutual metrics. It's a term that I've made up, but I like it because it's fun alliteration. But the idea is simply that they're indicators or targets that we can share across sectors or across programs. I think one of the big problems is that we each have our own indicators of success, and we track those things and we report our success, and then we go on our merry way. When we talk about working together or multi-sectorally, we're not measuring whether we're doing that. And until we have some common goals, we're not going to get to the same place, are we? So some examples: IFAD, the International Fund for Agricultural Development in Rome, is proposing to use stunting, child stunting, as an indicator for its agriculture development projects. That's a really nice example of a mutual metric between what's terribly important for nutrition, for health, because stunting indicates chronic insufficiencies, and for agriculture. So I think it's a great example. AGREE is a program that is brand new. It's stakeholders from the food and agriculture industry forming a coalition that they want to use to bring together groups that have not traditionally worked together. And their goal, they say, is that the current discussion on ag and food policy is not focusing on what's really important. Stakeholders talk past each other and fail to comprehend the policy implications beyond their own sector. So they're going to try to bring more common discussion, like mutual metrics. And this is funded by the Ford Foundation, the Gates Foundation, and a number of other foundations, mostly U.S.-based. So I hope something happens there. We'll keep an eye on that spot. Partnering for new programs and policies. Much has been said about public-private partnerships, and there are many examples that can be pointed to and many cautions that can be stated. Here's one example of PepsiCo supporting Mexican farmers to produce sunflower crops to substitute healthier oils for what they're using. And PepsiCo, as one company, is going to embark on a very ambitious program to try to eliminate palm oils from their production processes, and they're trying to lead other companies into doing similar kinds of things. There's a long way to go, and I don't think any of us should be fooled by promises that don't really mean something in terms of the outcomes that we're measuring. But I do also think that we can't do it without companies, so it's important to have the right rules of engagement. And policies, of course. Taxes and subsidies and other forms of regulatory policies need to be used. I'm not a fan of fat taxes. I'll say it right here and now. I think there are good reasons why we shouldn't be doing that. But having a debate, as has been happening. Denmark has passed a fat tax. France is about to do so. South Africa is thinking seriously about it. Having that debate is really a great opportunity for talking about what we can do to improve nutrition and address these problems. So I'm all for that. Developing operations research on things like pay for performance or other ways to create the right incentives. And the World Bank, I'm an advisor on a World Bank project that wants to use results-based financing for non-communicable disease programming. And finally, let me move to the research arena. I won't spend too much time here, except I hope maybe to encourage some of you who are interested to look into some of these directions. We're at a knowledge-producing institution here, so I know that there will be some hunger for research ideas. And the first one, the causal linkages across agriculture, nutrition, and health outcomes and metrics. We need the metrics. We need to sit down and have that hard discussion about what we want to be measuring in terms of mutual metrics. I can tell you right now that the set of indicators that is likely to be going to the World Health Assembly in May from the people working on non-communicable diseases so far doesn't have anything from agriculture, and nothing that I would say is from the food system. It has salt and it has fat. trans fats specifically. And we need to give them a metric from the agriculture sector, I would say, that can go into that set of targets and indicators. How would the agriculture world look different if we had some mutual metrics? How would nutrition look different? I'll just mention I've been working with a team at the London School of Hygiene and Tropical Medicine on a systematic review of the evidence that links these different sectors. And just so that you know, out of 14,500 titles that were initially captured in the first search, there were only 3 studies based on data that identified that it really evaluated the effects of agricultural policies, price-related agricultural policies on chronic disease. Now that's a sort of a narrow objective, but it's an important objective for us to pursue to have the evidence that we need. In the interest of time, let me go on consumption. There's an awful lot that we think we know, but that we don't really know. There's been some new work. Lawrence Haddad recently published a systematic review about what we think we know about agricultural interventions to improve child nutrition, and it concluded that the fortifying foods with vitamins and minerals is not showing a strong positive impact on nutritional status as much as we had thought, and needs to be re-examined. There's another new study out in the Lancet just this month with similar conclusions from Australia. On the production side, I've mentioned already a few things, I think, in terms of the supply chain. There are a few other ideas here. This is hard stuff to do, as I think IDRC knows better than anyone. It's not easy to find the experts that want to work across sectors and across disciplines. There's not good funding for it, although thankfully IDRC is again on the forefront with a funding solicitation for looking at non-communicable diseases very broadly. It's hard to find the data. And again, of course, we don't have very good common measures. But I think that's what makes it very challenging. And so I would challenge you to work with me on this. Let me go on to just I'm going to only click through 5 recommendations without discussion, but just to sort of whet your appetite maybe for our discussion. 1 recommendation each for the actors that I mentioned are the key ones. On the donor side, donors can assess the structural and programmatic opportunities for linking programming. Really, people do what the money dictates. I think we all know that. As long as the money is flowing in a segmented way, then people who are researchers, people who are implementers, people who are the recipient countries, they're going to respond in a segmented way. And so I think that is tremendously important that donors reassess how they do things. National governments in developing countries I'm speaking of, but it could apply to us here, need to conduct a cross-sectoral dialogue among government ministries, and it needs to be at a high level so that all ministers are responsible. And if they have mutual metrics, let me give you an anecdote. The Minister of Health in Rwanda, with whom I met a couple of months ago, she said, you know, we have this goal in Africa that we've set to spend 15% of national budgets on health. And I am the only country, Rwanda is the only country that has met that goal. How did I do it? I said to each of my fellow ministers, how much are you spending on health? Look, you're spending this and this and this that achieves public health goals. I'm going to add that to what we're spending on health and show the president that we're spending more than 15%. Instead of telling the other ministers, you ought to be doing this, she said, you are doing this and it's helpful and I'm going to give you credit for it. Instead of coming with a begging bowl and asking for you to spend money on my objectives. We're going to have common objectives. I think that was brilliant. And it was good PR too. So I think that needs to be done. International organizations, I talked already about mutual metrics, and I do think that that's what's needed to help align us. Consumers, very important, lots of things that consumers and their organizations can do. One is to educate and to bring these links into education programs in schools and outside of schools, and continuing education and professional education and so on. And finally, agri-food business. I'm a big believer in targets, as you can probably tell. I think people achieve what they're rewarded for achieving. And so within business, if there are targets for whatever the goals are, whether it's reformulating products to have more nutritional benefit or whether it's other things, I think that is going to lead companies internally to reorganize themselves. And I'll give you one anecdote without naming names. There is a company that is now telling its senior management that they have targets to achieve nutritional outcomes, And their compensation on an individual level is going to be based on achieving those targets. That's what's going to get a response, and I think that's what probably needs to happen more widely. So I'll just say we've had many decades of UN resolutions and documents and a lot of discussion about achieving multi-sectoral actions. What's different now is that I think we really understand the problems. We know where they come from. We know a lot about the costs of those problems. We know who can change things. We have some specific ideas, and I think that we have the wherewithal, capacity, and motivation to make those changes happen, and I hope that you will give your ideas and help and correct if I'm wrong, and thank you for your attention.
Thanks, Rachel, for what I would qualify as a very dense, rich, and filled with example presentation that was extremely interesting. I'm sure the audience will agree with me. Before I move further, I forgot to mention in my introduction that we have simultaneous interpretation services that is being provided. So if you are less fluent in one of the official language of Canada, I encourage you to borrow some of the hearing piece. And for the question period that we will move directly into, I will ask you for two things. First, if you could introduce yourself. That would be nice for Rachel to know who you are and where you're coming from. Secondly, please maintain your comments or question to a very brief moment. There's many people in the room, and I'm pretty sure there's going to be a lot of questions. And the same would apply also for the people that are looking at us on the web. If you have a question to send, please provide your name as well as a brief question. Sometimes I get long paragraph. It's a bit difficult for me to read while I'm trying to moderate also the discussion. So without any further ado, let me thank you again for this very interesting talk, Rachel, and we'll move directly into the question period, and I'll take 2 to 3 questions at a time, and we'll have a few rounds of those questions. Anyone that wants to break the ice?
I guess I will. My name is Jim Hamilton. I'm from CHF. Thank you very much for an informative talk. I was struck by the fact that you didn't talk about water. Now, particularly in Bangladesh, you know, they've recognized that arsenic is in the groundwater for many years, and that's a public health problem, but they haven't recognized that groundwater irrigation from arsenic-contaminated areas is being applied to the crops. And I think it's not recognized, obviously, in Bangladesh. There's about 88 or 90 countries in the world that have arsenic problem in the groundwater. There's other problems of manganese, and which has a deleterious effect on especially particularly young children's learning ability. But arsenicosis has, the obvious symptoms of skin lesions and keratosis of the skin, but also all kinds of cancers. So it's interesting to me that there's no discussion or no thought of what arsenic can do in terms of the food chain.
Thank you.
My name is Bik Mikolayuk. I was with IDRC 93, 2001. My question is, how do you see how these results of this high-level research can be presented and transformed at the cognitive level of people who really need this knowledge? I mean at the community level, or like women in Kassala, whose only food is some cereal boiled with water. They don't know other food. So my point, or one of the recommendation would be to find out the communication channels that this knowledge which we gain from researching poor people, that they will get directly something from this.
Thank you very much. Susan.
Hi, I'm Susan Robertson. I'm a senior program officer with the Agriculture and Food Security Group. I'm curious about the lack of metrics between ag and the nutrition side, and whether or not you think that the new CERP with the CG centers will address that particular issue, and given the size and scope of that program and the fact that it's the new direction in ag and health research. Thanks.
And CRP relates to CGI, our research program, large research program, and there's one that is related to agriculture, health, and nutrition. Rachel, before you start answering the question, I'm just going to pull back the podium because the people at the end of this room cannot see.
And I couldn't see them, which is too bad. Okay,
So please,
you can go ahead.
thanks.
Thank you very much, everyone. I appreciate the questions. Let me try to respond fairly briefly, and they all will be food for thought for me too, so rest assured I'll keep thinking about it. Jim's question about water, and particularly about contaminated water, and why I didn't mention that, I guess I'll give two answers. Yes, it's very important both for child health as well as adult health and the cognitive effects on children that are long-lasting. And it gets into the food chain. I think I referred to it in part in the sort of first generation of research and policy efforts on how agriculture and health are connected, which isn't to say that that stuff is all solved and done with. By no means is it. It's simply that I was concentrating on sort of the newer health outcomes that have only just kind of reached the global stage. I think that there are links in this area that I haven't made directly in this report, particularly to things like water and sanitation, much better links than I've yet made. And so I don't think that those issues ought to be excluded. They are really, I guess in my earlier work in urban and para-urban agriculture, some time back, I was highly cognizant that the contamination that happens in the environment that affects people through the food system, as well as directly when they're working in agriculture, is underappreciated often because there are long-term effects, and it's hard to measure the exposures and the health outcomes. So that's particularly an area where we need to keep talking about it because it's easy to ignore it. And so I guess it's to say that it was sort of outside the scope of what I was doing directly for the NCD meeting, but I recognize its importance. Thank you, Jim. Vic's question about how to transform for those people who are working at the ground level, for the poor farmers and the women who are working on these things. I think it's a key issue, and that's why I continue this dialogue with Courtney in South Africa and people who are working at that level. What I've come to understand is how little knowledge there is often in those communities about what we take for granted. Again, I'm speaking about particularly the non-communicable diseases and how nutrition affects them. So I don't want to imply that people have little knowledge about their food systems or agriculture, the things that they work on every day. But non-communicable diseases are really a hidden problem in a lot of, they're an invisible killer. The hypertension, for instance, is very big in Africa, and there are very high prevalence of deaths from stroke. People until recently had not ever heard of stroke and hypertension. It relates back to the food system and other things happening. So the lack of knowledge is really a serious issue, and that goes both for the risks as well as for what can be done about them. So for instance, this guy working on supply chains in South Africa, he says, these are really uneducated farmers, and I think those are the people that you are concerned about. You have to be able to speak to them about what's important. He uses an example of, how would they prefer to pay for a cold beer or a warm beer? Would they pay a little more for a cold beer than a warm beer? And he uses that as the example to help them understand why they might want to produce something with a little bit more nutritional value or a little bit more appeal in the market. And that they understand. I think it's a reasonable example. It's going to differ, and these things they become very site-specific, very population-specific. So I don't have any general rules except that I know that education and getting it to a level that really is directly relevant to them, whoever they may be and wherever they may be, is critical. So nutrition education has a role to play, but as I sort of alluded to earlier, I think we need to harness the ability of companies who do market their stuff and who do know how to reach all kinds of consumers and challenge them to work on the bottom of the pyramid and reach those consumers with positive, important, credible messages. So, for instance, Danone has been working to develop products for the bottom of the pyramid in Bangladesh. as we were speaking of Bangladesh, with specially formulated yogurts. And that has been quite successful. It's just one example. It's not fully financially scaled up yet, but I think that there are some examples that can be looked to, so we can do more on that. And lastly, on Susan's question on a lack of metrics, I think the CG initiative is, I don't know where you went, Susan, is a good and important one. I think the jury is out. I'm not convinced. I have been looking, as I mentioned yesterday, in my spare time for fun, I read through new initiatives and strategies and solicitations that donors are putting out, like DFID's new nutrition strategy and USAID's solicitations for implementing their programs. And I look for any indication that they're operating kind of with a broader view of this or trying to implement some more connecting up, and I don't see it. But CGIR's initiative is an exception. It's just too new, I think, to know. I don't think that the history, I think it's a mixed history. So I hope that it goes in the right direction. I'm talking too long.
No, don't worry. I'm going to take one on the web here from Anna Janet. She's asking very simply, what are the linkages between incremental income for smallholder farmer from agricultural development programs and health? And sir, I'll go to you now.
My name is Brian Hull. I'm director of the Institute for Strategic Economics and chair of the Hunger Project in Canada. And we, as a mission in the Hunger Project, empower the poorest people to bring their own hunger to an end. So we work with the resource poor, farmers in particular, in Africa, in 8 countries. And to me, this conversation actually illustrates one of the challenges, and I'm going to address the question that the speaker immediately before me at this mic raised, which is how do you get the message across? Because we take a holistic approach, and the difficulty with the academic intelligentsia approach is it particularizes and focuses and then shares as you did. So you did a brilliant presentation. But speaking as an economist and somebody who's committed to the United Nations development goals, where the clear metric is the infant mortality rate, and where NCDs are predominantly a function of childhood nutrition, and where focusing on childhood health is the largest, most important, most powerful intervention to alter the path of NCDs later in life, that what we need to talk about is high leverage. In the Hunger Project, we do high leverage. We impact 35 million people with revenues equal to about the annual revenues of a Canadian private school, for example. Who does our work? The citizens of the countries in which we're engaged. So my leadership is in Canada. It's not in Africa or India or Bangladesh. But clearly what's missing is the poorest people speaking on their own behalf, where a holistic approach is needed, where empowering women is needed, where governance at the local level is needed. None of this fashionable among the academic intelligentsia of the world development community. And my question is really the same as the chap that stood before me. It's how do you get the message across? Well, step one, go to our website, The Hunger Project. It's very thorough.
Thank you. Mademoiselle?
Okay. I'd just like to thank you, first of all, for your speak. It was very informative. My name is Victoria, and I'm a student at University of Ottawa in International Development and Economics, and I have a particular research interest in agriculture. So I just wanted to make a few comments about your speech first. When you went through the value chain or the supply chain of agriculture, I noticed that you left out what I found through my research when I was in Bangladesh, researching with small-scale farmers who were receiving microcredit. One key element that was missing were the middlemen who took the crops to market or to the crops to big suppliers. And from my research, I realized that that's like a key point of exploitation, and that was a huge contributor to the vulnerability of small-scale farmers because they didn't get proper price for the crops, and therefore they weren't able to, meet their basic needs. So I just wanted to ask you to speak on that a bit. Secondly, also through my research, I noticed something that was quite alarming to me through the progression or the trajectory of agriculture from past to present was the prevalence of big-scale business, agribusiness, and the threat to biodiversity of monocropping and those big cash crops that you seem to highlight as success stories, Costco caches and that type of thing. From my research and experience, that takes away from diversity of food for small-scale farmers. And it also forces farmers to convert to crops that are intensive in pesticide use and that sort of thing that I would assume would be negative to health. And lastly, sorry, I'll quickly wrap it up. Food security, and could you speak a bit to how perhaps land tenure ownership would contribute to food security and health at all? Sorry, I know that's a lot. Thank you.
And for those of you that are coming to the mic, don't think that I'm going to let 3 questions and 1 question come back. It's the last time. So, Rachel, why don't you answer those questions? And after that, I'll take you, the 4 of you. So I suggest that others present themselves to the other microphone, and I still have some questions on the web also. So, Rachel, yours.
Okay, great, thanks. I'll try to be a little bit briefer as well. I think a couple of the questioners, Anna and part of Victoria's question, as well as some of what Brian was asking, relate particularly, of course, to the resource-poor farmers, to the smallholders, to those that don't have adequate resources. And let me refer again to Reardon's work, where that group was clearly the group that's being left out of what I was talking about. And that makes them very vulnerable on 2 counts, as producers as well as consumers. And we've known that, and we've seen that for a long time in agricultural development. It's the group that we have kind of consistently not reached well enough. There are many ways to try to reach them. They need so much, whether it's some more education or whether it's credit, like microcredit, whether it's dealing with the unsanitary conditions that they live in, et cetera, infrastructure and so on. There's a lot of things that they need. So I don't come with any golden bullet for that. I think it is important to remember that we do have interventions that work. Poverty remains, for the MDGs and for the development community, the single most important goal. And we should be scaling up the interventions that are well proven. I wanted to make, and I think I did make a couple of points, though, that are relevant to this. One is that there are interventions out there that we thought were working or would work, and they maybe are not doing what we thought they were doing. And I'm referring to the recent systematic reviews on food fortification and on some of the other very popular interventions. So one is, we really ought to have clear what outcomes we are after, how we're measuring them, and honestly, incredibly, do that. And that, I think, is just good practice in development. Secondly, yeah.
Can I interrupt you here? Because, and I'm going to use my prerogative. Yesterday we had a presentation at CEDA, and this question of biofortification came up, and question about this ADAD study. And you brought it today again, and you're using it in your answer over here. But can you specify a little bit what was in that study? Because, what ADAD is saying, I believe, is that, the biofortification has not shown, extremely clearly, but more traditional fortification of food like salt ionization is working. So is there a nuance over here? Is it only about biofortification, or it's about the fortification of all food that there's limited evidence?
Thanks, and I'm looking for the specifics in my notes here. I'm not sure whether I'll find them, but I think that the point is really important. The Haddad study is about child nutritional interventions. It's broader than biofortification, but it includes it. And the conclusions were that, so for things like vitamin A, iron, folate, we know that those are tremendously important. We have interventions that work for them. They're very cost effective. There are specific populations that need them at certain times in their lives, and those things they need to be scaled up, and they are being scaled up, and those are not into question. I think that when it gets into some of the biofortification and some of the other kinds of nutritional interventions, that there's really quite, I think, a legitimate questioning of the nutrient-based approach to childhood to child health and child development. And I think that sort of more broadly than individual interventions, that I think Jean is bringing out that point more precisely. I think that's what we need to take a look at. And what I would suggest, and this gets to what I wanted to say to Brian, is that we can get at that by having a broader view of what is affecting children and others at different stages in the life cycle. So whether it is the non-communicable diseases that we're interested in, or whether it is the health of children from 0 to 5, or even in the first 1,000 days, we now know a lot more about the biology of what's happening as people go through different phases of the life cycle. And we know that the developmental origins, or the Barker hypothesis, if you want, the developmental origins of health, they start very, very early. And that we can, I think people are reasonably familiar with, so I'm kind of shorthanding this, we can influence the later in life health risks from the time that an adolescent girl is even beginning to become sexually active through the right nutritional interventions. But if what we're saying is you just need to have more macronutrients or more of these specific micronutrients, even though some of them are important and are necessary at that stage in life, that's not the whole story, and that's not going to deal with this issue of later in life risks. So it's very possible for a child to go from being a low birth weight baby to having fast growth in the first few years, becoming stunted, and then overweight, and develop diabetes by the time they're in their teens. That can happen through a process that we now know a lot more about, but the nutritional interventions, and again, I'm maybe not I want to be careful with language because Jean rightfully called me on that. Some of the nutritional interventions and the broader view of what is needed for child nutrition is not taking that into account. And that's what I've asked the nutrition community to work on. Bring some ideas about how nutrition interventions would look different if you were to take into account the developmental origins of health, for instance. So to Brian's point about how to get the message across, I think that we have an opportunity, and there are now communities, the maternal and child health communities, talking to people in the NCD community about how do we link up the maternal health interventions, the child health interventions, and what we care about in terms of the development of chronic diseases. And I think that's a very good thing. Coming up with an MDG. There's a lot of discussion now about needing an MDG for NCDs. I can hardly say it, let alone come up with the right goal. There's a lot of talk underway about the new MDGs. Will they be sustainability goals? Will they just look like the ones that we've already had with a few more things thrown in? I think that the jury is still out, but there's a strong advocacy community for having an NCD MDG. So watch that page. Last thing, on Victoria's questions, there's a lot there, Victoria. I don't think I'm going to try to tackle all of it. In terms of the monocropping, and there are a lot of issues that we're aware of, from the first green revolution that have been problematic. I think we are smarter now, and we don't want to have unintended consequences, and that's why we need to be fairly nuanced when we talk about, what we hope to achieve in different conditions where farmers have some resources and they don't have other resources, and I think we want to target the things that they need rather than think that the same solutions are going to apply to all. I would simply say, in terms of the involvement in the commercial supply chain, Costco and Walmart and those companies are smarter too, and some of them are working quite closely with foundations and researchers to try not to make the kinds of mistakes that you're pointing to. I'm not going to say that they don't make mistakes and that they're certainly interested in profits. They haven't changed the whole business model, but I think that there are some real opportunities for that shared value that Michael Porter and Mark Kramer talk about, and others are trying to kind of research. And yeah, this maybe sounds a little bit like academic intelligentsia, but I see people at the World Bank, I see people at FAO. These are places that don't change easily, but they are quite committed to re-examining a lot of the way they've done business in the past. And so I'm always a glass half full person, and I think that there's some good things happening. I think that I kind of covered things.
Good. So it's going to be our last round of questions. I'm going to add you to the list of the 4 persons that we have here. For the matter of time, we have about 13 minutes. Can you state your name and be very brief with your question and comments? And sir, we'll start with you.
Yeah, hi. My name is Sudhir Kodati, and I come from an agriculture background. I did agriculture for 5-6 years before moving to the West. Also, about 5 of my immediate neighbors committed suicide in the span of 5 years. And this in the period of 95, 96 to say 2000. This is also the period where the liberalization, globalization was basically on the increase in India, because the liberalization reforms started in 92 and then slowly. Now, in the last 10 years, about 100,000 farmers committed suicide, just in 2 states. So it's from that pain and personal angle that I'm trying to reflect. Now, I heard a very perceptible gasp when you said the role of China in apple trade is. So imagine if the same happens in about 10 major cereals, protein-based, or fruit or vegetable-based. And if it happens, if those 10 come from the third world, or China, Brazil, of course, is not a third world, China for that matter, I don't want to. But if that happens, now I just want to see if the conversations is the same kind of conversations that will happen. The talk of nutrition and the food security, is it somewhere linked to also the interests of the Western agribusinesses? Now, I want to sharpen this by saying the previous point that, say, if the 10 products that are consumed in the West come mostly from the third world, will the conversations remain the same? Number one. Number two, now, how does this impact to the nutrition at a family level? And say, for instance, the conversations beginning from the top, initiated by the global organizations, the donor agencies, if the conversations happen from the ground, community activists, nutrition experts, farmers, and then it throws up, and somewhere if these 2 conversations meet, maybe I think you'll probably fine-tune points for further dialogue.
Thank you very much. Sir, and I will only allow you to ask a question. You know, if you can keep your comments, please. We can share it afterwards, but we have a timing issue. Your question, please.
No problem. Thank you very much. My name is Kiari Limantingiri. My background is development economist, and I have done my career in the United Nations system before I retired. Now I'm free to speak and say anything. I have 2 questions, but as the chair allows, only 1, so I will go for 1. I was very interested in the idea of mutual metrics, and I am strongly convinced that to make change happen, we need donors to put pressures. And I know that money, funding guide the things, but have you thought about, or do you have any kind of metric of donor coordination that works on the ground in this particular sector? Because from my experience, the most hard to coordinate are FAO and WHO. That's it.
You have a good experience, sir. Please.
Amanda Jones, the Non-Communicable Disease Prevention Program at IDRC. We certainly got the sense that there's a need to improve nutrition across the board, but I'm wondering, what do you feel the priority areas to improve nutrition to have an impact on NCDs? And how does this relate to any indicators or targets that might be developed after the high-level meeting on NCDs?
Thank you very much. Very sharp question.
Very short question from a very short individual. My name is Victoria, and I'm with CARE Canada. I looked at the list of 5 hectares that you gave us, and I wondered where children fit into the list. Do you think they have a role to play? In particular, I'm thinking of them as the future leaders of these 5 hectares and the future leaders of their own nutrition and the nutrition of their families. What is the role of education and children in preventing NCDs in future?
Thank you very much.
Hi, my name is Natasha Lecourt. I'm also with the Non-communicable Disease Prevention Program at IDRC. My question is really short and simple. I just want to know if you could tell us more about the reason why you're not a big fan of the fat tax. I'm not a big, I don't know all the details around that debate, but I'm interested in the debate around regulatory versus voluntary approaches. And I think you gave a lot of great examples of food industry efforts in this context, but the one that caught my attention was the one you gave around PepsiCo, and I think it's great that they are trying to get rid of palm oil, but to borrow words from one of my colleagues, we really need healthier soft drinks. And I'm wondering if
that's a tough order.
I'm just wondering if you think there's space for a regulatory approach in this general context.
Thank you. And I'm going to take a third because the second question was the intervention that I made was coming from Peter Birdie at Health Bridge. I didn't mention his name. And now we have Lynn Taylor Prescient that is saying the world map that you presented is quite surprising to me. How much research has occurred with paralleling the impact of high fructose corn syrup and GMOs to poor general health in North America? Well, you might not have the answer to this, but I'm just bringing this last question to you, Rachel. You have about 5 minutes to choose, pick, and answer some of these questions. I don't think that you can address them all, maybe, but the mic is yours now, Rachel.
Thank you, and I'll try to be as disciplined as the questioners were. Thanks for the great questions. Suliv's comments and question, yes, there's a lot to be concerned about in this whole realm of globalization and world trade and who really is benefiting from it and the tragedies that can occur when people are left out of it, if that it seems to be the only choice that is supported by governments and by others. I think that the ground level conversations that you mentioned, I don't know if, yeah, there he is, I can't see you, Saliv. The ground level conversations are critical because, as I mentioned already, that much of this, when you get right down to it, is fairly site specific. You know, when you talk about food and food choices, I didn't argue extremely strongly because I'm not here to talk about nutrition today, but it is really important that we do better on identifying what a quality diet is, what a diverse diet is, and our concentration on quantity rather than quality and diversity and those kinds of things has really, I think, led us astray. And yet, I searched long and hard for good measures of dietary diversity, for instance, and I became quite disappointed with the nutrition community because they couldn't offer me that. Some of that really has to be decided within communities, and a person that's worked on some of these things, I think, in a wonderful way is Kalestis Juma, who is a professor of development at Harvard, and he has a new book out on biodiversity, and he's done some really marvelous work on food diversity in local communities and in indigenous plants and so on. So I would recommend his work. Dr. de Montigny's questions about mutual metrics and donors putting the pressure on, I'm glad that you like those ideas. I think I know your work, and I'm pleased that you're here. The donor coordination. You probably saw the recent review of the donor coordination effort that the Paris agreement and Cairo that was reviewed for the Busan meeting in November, and I think there was only one of the criteria that donors actually had been able to achieve in the goals that they set for themselves, and that was talking more to each other, basically. So it's not encouraging. I spent some time at FAO. I've worked a lot with WHO in recent years, but my conversations with them, I guess I'm a little bit hopeful now because they are really under some pressure. When they're not under pressure, it's easy for them to go off and do their own thing. But in some respects, the more pressure they're under, and they are, particularly WHO, under very extreme financial pressure, they can't go it alone. And I think it's up to us in this room and those that you talk to keep up the pressure to say that this multi-sectoral stuff can't be left out. It's part of what the General Assembly asked for, but it's not the top thing on the agenda of the health community, and the chair's going to hit me in a minute, but let me give you one quick anecdote. From the launch of this report in September, I had a number of people on the panel who are from the agriculture world and a couple of people from the health world, and the agriculture people said, look, we think the agriculture community is really ready to work together in a serious way. We've been ready for a long time. We perceive that the health community is not ready. And I hadn't thought about that before. I hadn't, because I've been in health for a while, I hadn't really perceived that, but on thinking about it, I think that they were right. And so I am pushing very hard in the health community to get their act together on working together. And as I said, I think maybe the budgetary constraints at WHO will help force that. Let me move on the children and where they fit in the prevention of NCDs. I've talked with a lot of the sort of traditional health communities, and that's the child health community, the infectious disease community, the maternal health community. Those are the ones that have gotten the attention and the funding and the partnerships and the commissions and all that. I do think that we have an opportunity to share the territory and not to make it an either or. You know, my disease is more important than your disease kind of discussion, which seems to happen in that global health world a lot. Because of the developmental origins, the importance of the biological transmission of risk that I described earlier, I think that the children and the adolescent girls and the young mothers can be really central to this whole discussion about NCDs. You know, nobody's going to care that much about 40 and 50-year-old people. I mean, well, I do, but in the donor community, it's just too hard a slog to get people to worry about someone who's reached middle age and has diabetes and strokes out or dies of, or has to spend all the household income trying to manage their diabetes. It's a tragedy, but it's not going to draw the donor dollars. What will draw it is showing the connection to child and maternal health, and I think it's there. And then lastly for Natasha, well, maybe not quite lastly, Lynn, lastly for Natasha on the fat tax, really there's plenty of literature in economics and public finance and so on to show that you have to look at what it is that you want to change. Yeah, you want to change consumer behavior, but you really want to change the nutritional value of products that consumers want to choose. So it's not a simple problem, and if you apply the fat tax and you don't change, you know, you're going to change the price of that soda by, 1/15, a very small amount. That's not going to change how much people buy soda. But if you change the ingredients and you put a tax on certain inputs, that can change the formulation and that can change the nutritional value. There's a lot more to say about it, but it's too simplistic an approach. And for Lynn on high fructose corn syrup, I don't have anything to say about GMOs, but I do think that we do need to pay much more attention to the ag policies and nutrition policies and how much they affect the health outcomes. As I said, I've tried hard to show the causality. Until you get to a very specific level with specific policies in a specific country at a specific time period, you can't show the causality. There are different effects that happen, and you can't say, oh, this is leading to higher food prices or lower food prices or worse health or better health. It needs to be very specific, and there's some work that's going on in that area, and I won't touch GMOs. Thank you. Thank you for the questions.
Well, we did it on time with the 5 minutes. I don't know how you did it to answer all those questions in 5 minutes, so congratulations on this. Before we move to the close, note of thank you. I want to thank Don Lucas and our team that has prepared the room and all the facility, the team that is with the translation and interpretation services, many thanks, as well as our video, audio, and web team that have been in the background providing the good services and making this run fluently. Not to say at the end of the day the communication team of IDRC that is in the preparation of all of this. So they deserve a round of applause, please. And let me close in bringing you in a good spirit of the three key messages to take home, I think, that I take from your presentation and the number of quality intervention that was made. There is tools that are present out there to help out with improving the state of health vis-a-vis the non-communicable disease, the nutrition and the agriculture, whether they relate to value chain, mutual metrics, partnering, new policy. They are all area where we can do something and we need to do something. And fortunately, this will get done more and more through better coordination among the various stakeholders and ultimately also through a research agenda. Rachel push us towards the research agenda into addressing the causal linkages between ag, nutrition, and health, investigating consumption pattern, whether they are related to quality, policy, and others, as well as the production itself of food for better health. So, the tools, the coordination, and the research. And fortunately, I work in an organization where this is taking place at a scale that is the scale of the organization, whether it's through the program of the non-communicable disease prevention that Michael Clark and Greg Allen are leading, or through the work of the EcoHealth program of Dominique Charon of the agricultural and food security. There is internal coordination, and also great stride in working together outside of the wall of the organization through different mechanisms. That said, it's time for me to really thank you, Rachel, for coming here. Those of you that might not be aware, Rachel came yesterday straight from Ghana to deliver a talk at CETA, and this morning she's with us and on a journey that is not over yet. So that's all to your merit. Thank you very much. It has been a very interesting talk. The name of the report is Bringing Agriculture to the Table: How Agricultural and Food Policy Can Play a Role in Preventing Chronic Diseases. Leave your cards, take copy at the back, or download it in PDF form on the website of the Chicago Council of Global Affairs. Rachel, it has been a pleasure once again to have you with us at IDRC, and looking forward to more of your work in the coming future. Thank you very much.